Okay. The Bevan Commission is really unique to Wales, and like you all are in the work that you do, it's very important that we recognise that the origins of the Bevan Commission, and in fact the origins of the NHS in Wales, actually sprung from people, from real communities. And listening to a few of the earlier presentations, we must not forget that what we're about is about those experiences, about the communities that we are operating within. And if you looked at an R.M. Bevan, we often ask ourselves at the Commission, I wonder what he would think of the NHS now. I think it's also important to note that actually no problem can be solved by the same kind of thinking that created it. So whilst the Commission recognises that we are true to its values and principles, free at the point of delivery, accessible by all, and comprehensive, what is important is that we don't just bury our heads and remain in the last 70 years. We all know that the needs now are significantly different to the needs when it was designed 70 years ago. And so therefore the Commission is really about challenging the status quo, trying to understand what and how we can make the NHS, the health and care system, relevant to the future. That's really our raison d'etre. We were set up 10 years ago by the then Minister Edwina Hart. And in truth, what she asked us to do was to analyse, scrutinise, advise and comment on health and related issues in Wales. And we certainly do that. But we do that by drawing upon a huge wealth of expertise. And when I was speaking earlier, I don't think we realise what a unique opportunity we have in Wales. Our commissioners are internationally, 24 of them, they're internationally recognised in their own fields. We draw on people such as Don Berwick, Dame Sue Bailey, who was chair of the Academy of Royal Medical Colleges, Lieutenant General Louis Lillywhite, Surgeon General of the Armed Forces, Professor Sir Michael Marmot, Baroness Laura Finlay, and so on. We are chaired by Professor Sir Mansell Aylward. We draw upon a massive and rich source of expertise, knowledge, and influence. And that is what informs what it is we do, what it is we think about, and how we do it. We also draw on the realities of what it's like out there and what the realities of, if you like, the day job are. But just to really give you that feeling that this is what we've got that is unique to Wales. We have this rich source of incredible expertise. And so therefore, what we're about really is trying to understand how we might continue to challenge what is there, whether it's at government level. We are independent, we are autonomous, we therefore can comment on and advise in a whole range of ways, and we do, and we choose to. So we will challenge what's there if we don't think it's right, if we don't think it's appropriate, and if we don't think it's likely to meet the needs in a way that we think is appropriate then. We want to therefore also understand how things can change. It's very easy to write documents, it's very easy to comment in a document, but it's less easy to understand how you can influence that change and how you can then champion that so that it becomes part of an ongoing practice. What we were challenged with about 6 years ago now was a whole range of things happening around austerity. We understood that there were a whole range of complex interacting factors, and we looked around internationally to see who was doing what was out there. There was very little out there 6 years ago. We looked at parsimonious medicine, but that was about it at the time. So we developed our own thinking around that, and by the way, we develop our own thinking around a whole range of things, whether it's workforce, whether it's primary and community care, whether it's the rights and responsibilities of the citizen. It's a whole range of things. But for us, this was an actual turning point in that we really challenged ourselves and said, okay, given what we know, given what we know about our trends and about where things are going, people are living longer, etc., what is it that we could best do to help inform Wales and the way it's going? Prudent healthcare came as an absolute crucial component, which we tried and tested with clinicians. And if you go away with anything, just go away with prudent health and care. Really fundamental, based on 4 fundamental principles. The first one being achieving health and well-being through co-projection with people on an equal footing. So it's not about just illness. It's about making sure that people, by whatever means, are enabled to keep healthy. The second one is about two components. One is about caring for those with greatest need. And the reflection I will ask you is how and to what extent do we do that? And the second part of this one is actually using all skills and resources to best effect. To what extent do we use the skills and resources and the assets that we have in our communities, in our patients, in our public, as well as our professionals? I think there is a tendency for us to continually look towards professionals, but there are other solutions out there. And I think what we've been looking at is what those might be and how we might make health and care sustainable for the future. And that is the real challenge. The third component of prudent healthcare is around, of course, doing only what's needed, no more, no less, and of course, do no harm. We recognise, of course, that within the system, we don't always do that. And so therefore, what we're looking at and trying to understand is, so what might we do to help influence and change that so that we are doing what is needed by the person or the patient and what is appropriate. So we're really interested in understanding that. And of course, this issue of inappropriate variation still hangs around. This issue of transparency. Do we give our patients the letters? Are they seen? Is it open and transparent? Is there data, for instance, for us to assess who gives us our care, who has got the, maybe the best achievements in terms of their clinical care? So we're looking at all of those in terms of how do we therefore take that and make sure that our thinking is translated into something that is really meaningful for Wales. We're also influencing wider afield. So internationally, we're also looking at how we can help others in this field. So we don't only just stick to Wales. But our influence, for instance, in the last couple of years has been in influencing a whole variety of policies, but particularly building a healthier Wales. And you can see within this that the prudent approach is seen as the underlying philosophy. And so really important that we keep those four principles at the forefront. But there is something that says, how on earth do we then take that concept and apply it in reality to our everyday work? And one of the things that we started was looking at the rich resourcefulness, the rich expertise, the rich knowledge that our 80,000 people who are employed by the NHS have within them. Do we give them the opportunity to come forward to be part of that process of putting forward some ideas, of thinking differently, and of enabling them to do so? And that is what we recognise was actually we at the top haven't got all the ideas. Actually, most of the ideas are in those people who are working at front level and understanding the complexities and the interactions. And so we created three elements. We created an environment that would enable people in the system be part of improving and changing and transforming the system that we have. This is iterative, it is ongoing. And what we look at, I know John will be speaking about improvement later, but what we're talking about, I think, is more radical transformation. So we can improve things we do, but actually what we would say is some of those things we do we may not need to do, or we can do very, very differently. And so therefore we think that the need for us to think outside the box, not just to have the same way of working as we've had for the last 70 years. So we're really kind of thinking there's bigger, much more, perhaps dynamic, different solutions, but they come with a risk, of course. If you do something and it doesn't work, then of course we haven't got an environment as yet where we accept that as a learning process. And of course that is exactly what it should be, a learning process. So we created three, if you like, cohorts. We created Bevan advocates, who are members of the public. If you were in industry, you would be accessing focus groups on a regular basis to understand what your customers are looking and seeing and whatever, and what that new iPhone or whatever it is you're doing. We really underutilize the experience, the expertise, and the understanding and the knowledge that our patients and the people that we work with can bring to us. So we work with a whole host of what we call our Bevan advocates. We also work and have a whole range of Bevan fellows. We started off with early career clinicians wanting to ensure that their thinking was, you know, in a similar way, being dynamic and being thoughtful for the future. We had to then create senior fellows because we were increasingly being approached by others who wanted to be part of that. And basically 3 components to those were leadership in a work environment, challenge and innovation, so an innovative piece of research supported by education, a paper and a kind of learning, but very much more dynamic, using our exemplars, using our commissioners as mentors and opportunities to provide that support. Our third component were people in the system. Anybody in the NHS, have you got a great idea? Is it prudent? Would you like to work with us? And can you deliver what it is your idea is within a 12-month period? That is it. Later on this afternoon, I'm going to the last cohort of our cohort 4. We have on average about 40 to 50 people. Last year we had 5 GPs, 7 consultants, and a whole range of other people from the health and care system, working some new ideas. And so we work with them to develop and support their thinking across a 12-month period. We then produce, say, a complete program of things, the learning that they have gained from that 12 months. And interestingly enough, we have had independent evaluation for the last 3 cohorts, and we are achieving an 80% success rate. That is quite significant. When you compare that the international average for particularly innovation and innovative projects is around 30%. So we're certainly on to something. But the belief is it's people like you, people in the system, that have great ideas. What we don't always do is allow them the platform and a system to enable that to happen. So what we do then is we enable through prudent healthcare. We actually try to support people through a process to do this. And what I would ask you really is, to what extent are you actually understanding this whole situation as it says there? So we enable these to happen we enable things to happen by doing in your day job. We enable things to learn from each other, and as I said, we've got now the success rate. We will start our cohort 5 the week after next, when we are looking at another cohort of taking these through. So we want to ensure that we, through the people in the system, maintain this prudent lens, maintain and drive those principles up there actually into reality down here. People come forward with a massive range of different ideas and different ways of delivering them. And I think it's really important to look at and learn from the iterative experience. And what we say to them is, you've got a good idea, it may or may not work, we'll give you that coverage to try it, but actually the learning and the experiential learning in which you will have done that is absolutely crucial. So that's, the kind of work that we would do. There are some challenges, of course, and we see this huge challenge of integrated health and care in the future. And part of that is something that the Commission is looking at in its wider sense. But actually, the understanding and the need to understand where people are at, where people that we are there to support, when they have very complex, they may be health, they may be social care needs, but we need to understand it. And what we're saying is that we need to see it through the patient's eyes and walk in their shoes. We need to understand how our teaching, how your teaching reflects what it's like to have both health and care needs, what it's like to try and bridge the system, what it's like to try and find your way through it and not just be labelled with a disease or 5 diseases or whatever. Actually, it's the person sitting down. And we're working with Social Care Wales and a whole range of people to try to unpack that a bit further. But I guess really how transformational and boundary crossing is your learning and is your teaching, and how do we equip our future workforce in order to address what we know is coming, this increasingly aging population that we would advocate we need to think about very differently than we are at the moment. The other challenge we see are challenges around health inequalities, and some of you may have seen Michael Marmot's work, whereby the life expectancy as we have known it in the past is now levelling off, and the gap between those that have and those that don't have is getting bigger. That is a reality for us all, and that is something that we can't dodge. And therefore, what we are saying is, how do we do that? Interesting, one of our exemplars actually tried to address this in terms of access to education and skills. And he worked very closely with his local college to try to understand, do we prevent people coming into medicine because of their social circumstances? And is there something that we can do? And Paul worked with us over a 12-month period to try to work that through. Further details on all our projects and all initiatives are in this booklet, and it's at a stand. If there is anything else that you would like from us as the Bevan Commission or like to work with us around, we'd be delighted to share it with you. But I think it's important to challenge and check, does your teaching, does your learning approach to learning reflect the realities of what we both have now, but also what we are likely to face in the future? Because that's the big one that we know is coming over the hill. So, all I would like to say is, as I said, we are on to driving and supporting that environment for change. And I think I'll leave you with one thought that I always think is very provoking, and I constantly remind myself of it. But it's to do with Albert Einstein, who says, insanity is doing the same thing over and over again and expecting different results. Thank you very much.